Welcome to Impact Maryland, gentlemen. I'm excited for this conversation today. And there's so much to talk about with Maryland's new cannabis policy that I'm going to start right away with questions. And let's start with you, Michael. So you are the CEO of Curio, a vertical operation here in Maryland. That means that you're licensed to grow cannabis, manufacture products, and sell it in your dispensary Far and Doter in Baltimore County. So if you could give our audience a little bit of an update on what's been happening since we went recreational and legal on July 1st in the context of this new legislative framework that you're working in.
I'd be happy to. Thank you. I have to start off by really demythifying some of the things that are known about this industry. So first, let me tell you a little about Curio Wellness. From our inception in 2014, we've really been focused on leading the pursuit of wellness through the research, development, and commercialization of products that improve people's quality of life. That's what we are as a company. We're focused on providing an alternative healthcare solution that has less adversity than traditional pharmaceuticals. And I'm proud to say that we've done that, and we have over, 15 different products today that are clinically tested and used across the state. So I sit in a particularly, I think, appropriate place to talk about some of the things that we've observed. Unfortunately for us in Maryland, the industry isn't booming as people believe it is. If you'd asked me in November or December of last year, was I excited about this new, larger addressable market? The answer was yes, but not because it offered recreational, but because instead of providing safe, effective, and reliable products to 160,000 Marylanders, we would have an opportunity to provide it to 4.5 million people. Regrettably, our legislature acted in a manner when they proffered this bill, that frankly is both based in a lack of information and really ignorance in the clinical definition of that, and then arrogantly executed in a way that has really stifled both the market and the ability for consumers to really participate in a robust way. So let me give you an example. Our industry was expected to generate between 105 and 115 million in adult use revenues. Where do we come up with that? Well, we've looked at the per capita consumption in other states, and particularly in Missouri, which went adult use and is still also medical in February this year. They're enjoying about $120 to $125 million per month in revenues. We're enjoying 90 million. Now, don't get me wrong, that's better than the 50 million we were doing, but it speaks to constraints that have been occasioned on the industry by the legislative regime and by the regulatory implementation. And there's many, many examples I can give you, but what really is happening here is not only have we stifled the industry, but what really pains me even more is that we've effectively reduced the opportunity for creating an inclusive and diverse industry beyond what we already have. Why do I say that? Because here we are 4 months into adult use, and there is no shortage of any product. In fact, there is an abundance of flower. There's an abundance of manufactured products. There's actually more product than the market can absorb. That's not really a good place to be, and it's a rarity in this industry that when you have a conversion from medical to medical and adult, that you don't have product shortages. But we do not have that because of constraints in the way that the industry has to operate, including things like we're not allowed to advertise, and we're not allowed to provide patients or customer services than any other retail service would be able to provide. And those things, compounded with other more technical issues, have really stifled the growth of the industry.
Thank you, Michael. Let's jump over to Matt now. Matt, let's go back into history just a little bit here. Part of the referendum that legalized recreational marijuana in November required the state to expunge the records of hundreds of thousands of Marylanders, and those Marylanders who were charged with simple possession of cannabis. So I'm wondering if you can talk to us a little bit about why the state is expunging these records and where you think the state needs to go next in terms of civil and criminal protections.
Great question. Thank you for having me here today. I think it's really important for people to understand expungement, the clearing of a criminal offense from one's record, and its role in kind of the restorative justice efforts of Maryland in cannabis legalization. And you really need to, number one, understand kind of the need for, what's caused the need for this, what the impacts of our current, our old system were, and how Maryland's effectuating this change. And, as you hinted at, I think there's some things we continue to work on. So we know, despite comparable illicit substance use across racial categories, the war on drugs targeted Black communities. And the ACLU conducted a study that showed nationally a Black person was 3.64 times as likely to be arrested for cannabis possession compared to their white counterparts. Well, how are we doing in Maryland? Well, we're not as bad as the national average, but still, a Black person in Maryland is 2 times as likely to be arrested for cannabis possession. And to really understand this issue, you need to get more granular. You need to look at the county level data. And we have counties here in Maryland where a Black person is 6 times as likely to be arrested, and we have one county where it's almost 9 times as likely. So what are the impacts of this disparate enforcement of cannabis laws? Well, first, this means more Black Marylanders are serving time for cannabis offenses, but it also means more Black Marylanders are suffering the negative ancillary impacts of having a cannabis offense on your record. And so part of Maryland's effort to kind of address these negative consequences, which we know include making it more difficult to secure employment, which is related to access to health insurance, it is a barrier to certain educational opportunities and even certain government benefits. So what Maryland's done to try to address these is it's created an automatic expungement provision, which means the burden's on the state government to identify individuals with that qualifying offense and expunge their record in a certain period of time. And this is really, from a restorative justice standpoint, is the best policy to take, because the alternative is to have the individuals with the offense petition the system to get their record clear, and when states do that, only 4 to 6% of eligible individuals actually seek an expungement. So I think the automatic expungement policy is a strong policy, but there's more work that needs to be done in this kind of social justice space with cannabis legalization. And Michael and I behind the scenes kind of talked about the need for cultural change around cannabis. And one of the areas where I think we need to move culture forward is in the area of civil protections for legal and responsible cannabis use. And that means not allowing discrimination in key areas for these folks. So looking at the issue of, housing protections, employment protections, access to medical care protections, education, parental rights. And these are issues that a lot of other states have tackled. Most states tackle in the medical context, but other states are tackling in the adult use context. And Maryland really hasn't made a lot of progress in this area until this session, when we did pass a bill that provides one type of parental rights protection. And the bill essentially says that legal and responsible cannabis use can't serve as the foundation of a child neglect claim in the Child Protective Services area. So Maryland's starting to move in this direction, but I think it's an area where more work needs to be done.
Thank you. Thank you for that. Michael, I'm going to switch back to you. We're going to talk a little bit about some of the recent momentum that we've seen at the federal level when it comes to federal policy on marijuana. So I'm just going to have you talk a little bit about this drug that we are able to legally sell here in Maryland now, but is still illegal at the federal level, how that affects your business and how a change would change the cannabis industry here in Maryland.
Well, thank you. Well, first I would say that the letter that the president through HHS sent to the DEA was encouraging in that it is for the first time an indication at the federal level that people want to have an honest and open dialogue. I'm also in the pharmacy business and have been for a very long time, so I understand the nuance of these issues very well. And Schedule 3 is a non-starter we were talking about this earlier. In order to be a Schedule III drug, you have two things that don't exist in the United States. A doctor would have to be able to prescribe the product, and a pharmacy would have to fill it. Those are only dictated by actual laws that are in place, and there are no laws in place to do that. So we in the industry who are kind of policy wonkish viewed that as a very good kind of initial conversation, but it's not going to end up in anything that's actionable. What would be good about it, and what the reason that the president used that particular venue was because there's a very punitive tax that we have to pay as an organization called 280E, which effectively gives us about a 70 to 80% federal tax rate on our earnings. Obviously not sustainable and not allows you to have capital invest, but it also constrains new capital coming into the market. So that was a signaling by the administration that they understand that the capital constraints are really impacting the growth of the industry, and that was really their way of stating it. But I think it's encouraging in that we published a white paper back in 2016 that asked the federal government to do three things. One, put cannabis under the FDA, under the Food and Drug Cosmetic Act. Two, normalize banking. And three, which included capital markets. And three, eliminate 280E, so those that were in the business or wanted to come into it could have the same unfettered access to capital that any other industry does. And I think we're moving in that direction, but my guess would be we're 24 to 36 months away from it.
Thank you. This is our last question. I'm going to hand this to Matt. When Maryland legislators made this law, they very intentionally created pathways for equitable access to cannabis licenses for communities that were harmed during cannabis prohibition. So could you talk just briefly about Maryland's plans here, how they're going to infuse this industry with social equity licensees, and how they're going to break some new ground?
Sure. With my work at the Network for Public Health Law, one of the things I've done is created a social equity toolkit that essentially catalogs social equity policies at the state level that are looking to address, DEI in the cannabis industry, because we know, nationally, people of color are not represented equitably in the industry, and we know here in Maryland, there have been challenges with our medical program. So the state was very direct and focused on this issue and put a lot of different policies in place to try to ensure more equitable access to the economic opportunities from the new industry. And, before we look at some of those policies, I think it's important to understand who the state is targeting with these policies, because there are constitutional restraints in developing these type of programs, specifically, the equal protection provisions in the Constitution. And so the population of people that Maryland's targeting with this program essentially fall into three groups. First, and the first two groups are people who either have lived in or gone to public school in a community that was disproportionately impacted by the war on drugs, and the state measures that based on cannabis arrests. And the third, population of folks that are targeted with these policies are individuals who attended an institution of higher learning where at least 40% of the students were eligible for Pell Grants. Now, if you meet those kind of qualifying metrics, that then opens the door to the policies that the state is putting in place, and you'll see things like technical assistance in terms of helping social equity applicants navigate the application process and navigate starting up a cannabis business. You'll see some financial supports in terms of low interest, no interest loans, and these are things that are fairly common in other states. We have incubators here. There's some programs that look to partner social equity licensees with existing licensees for both the technical and support and knowledge there. But I think the policy that's getting the most attention and is probably the most unique is the way the state is dealing with the first round of licensing. And so what the state has done is they've allocated the entire first round of licensing just to social equity applicants. And so that means, I think there's around 220 new licensees licenses that will be awarded, and those are all going to social equity applicants. And this is unique because we've seen other states in their kind of initial licensing reserve a specific category of license. For example, Massachusetts, with their delivery licenses, when those first came out, those were reserved for social equity applicants and licensees. But with Maryland, it's your standard grower, your micro, your standard and micro grower, processor, and dispensary licenses. So this is, a really kind of like daring approach for the state. And they've done another kind of little, like, I don't know if you'd call it a cherry on top, but they've created a verification system. So, free of charge, people can determine whether or not they meet those qualifying metrics to be a social equity applicant before they actually engage in the longer, more challenging process of applying. So, that's probably the policy that is getting the most attention in this space.
For sure. Well, thank you so much, both of you, for being here. I think you've given our audience some takeaways and some food for thought, for sure, on Maryland's new cannabis era that we're in. Thank you, everybody. Thank you.
Thank you.
Thank you.